Okay, and good morning, everyone. Thank you for being here today. I acknowledge we're gathered on Blackfoot territory, and I recognize the Métis people who share a deep connection to this land. My name is Shannon Phillips. I'm the Alberta NDP candidate for Lethbridge-West. Yesterday, Kathleen Ganley and my colleagues in Calgary held a press conference to share their concerns about Danielle Smith's plan to sell off our public hospitals. This video is just one more addition to a long list now of videos where Danielle Smith outlines her plans to dismantle public health care. She wants to sell off our public hospitals. She wants Albertans to, quote, have a payment relationship with their doctor. She said that coverage for doctor's visits was probably a, quote, error. She compared vaccinated Canadians to followers of Adolf Hitler, and she disrespected veterans by saying she would no longer wear a poppy because of public health measures during a pandemic. Those are her words, those are her extreme views, and they are part of a defined pattern of views held by Danielle Smith. So today I'm going to show yet another video, one we believe all Albertans should see. It makes absolutely clear Danielle Smith and the UCP want you to pay to see a doctor, and I will now play a video and comment further.
My wife is here tonight. She's an ER nurse, and often she works triage at the front window of the ER and sees an awful lot of unfortunate misuse and sometimes even abuse of our healthcare system. Thus answering the question, maybe if somebody had to pay for that, they'd think twice about going to the emergency for something that's not an emergency.
So what you just watched is Nathan Neudorf, the Deputy Premier, Danielle Smith's right-hand man, explicitly say, and I quote, maybe if people had to pay for emergency room visits, they might think twice about going to the emergency room for something that is not an emergency. Let's just let that sink in. We live in a community where thousands of people have lost access to their family doctor. They have no choice but to go to the emergency room for health care. In a community that has experienced a massive healthcare crisis due to the loss of primary care physicians authored by the UCP. And now the Deputy Premier is telling all of us that he thinks we should pay to see a doctor. The Deputy Premier, second in command to Danielle Smith, thinks that visiting an emergency room is considered an unfortunate abuse of public health care. This is the same UCP MLA who sat on his hands for 4 years while physicians left Lethbridge. He cheered the UCP's war on doctors. He justified it. He did nothing. The very problem that Nathan Neudorf thinks you should now pay for is the one he himself created. So this is no longer just about Danielle Smith's extreme views. It is a pattern and it is a plan. Not too long ago, the UCP candidate in Livingston Macleod said Albertans should take personal responsibility for having a heart attack. Danielle Smith herself has said cancer patients are at fault for getting cancer. And then there's Nathan Neudorf now openly stating that you should pay to see a doctor. He wants you to, quote, think twice about accessing life-saving care when you or your loved ones are facing an emergency. He thinks the solution to overcrowded emergency rooms with 15-hour wait times is forcing you to pay to get into that room. While the UCP wants you to pull out your debit card at the emergency room, I will promise you this. With an Alberta NDP government led by Rachel Notley, the only card you'll ever use to access care is your healthcare card. If you need a doctor, you will get a doctor, period. We will reduce emergency wait times. We'll make sure you don't have to drive 2 hours up the highway to deliver your baby. Our plan will extend hours to be more flexible for families and physicians. It will put you first. We will ensure there is a new clinic here in Lethbridge to meet people's primary health care needs. We'll bring the Lethbridge Medical Teaching Clinic to life, bringing more medical students and residents to Lethbridge to practice here, to start their careers here, because then we know they are more likely to stay. We'll work with Indigenous leaders to support Indigenous-led healthcare. Our family health teams will focus on the needs of our community and tailor services based on the greatest need. The Alberta NDP will make sure that public health care remains public and accessible, and most importantly, you'll never have to pay for it. Thank you, and I'll now take your questions.
We'll now move to questions. Please off the top state your name, as well as the issue with,
I'm Mark CTV Lethbridge. Shannon, I am just curious, seeing as Rob Yashiro is Nathan's direct competition during this election, why isn't he here to also make this announcement with you?
So for the past 4 years, I've been an incumbent and Nathan Neudorf has been an incumbent. And I have held him to account for the past 4 years, including just a couple of days ago when I asked him to apologize to our community for his leader's remarks, comparing the vast majority of Albertans to Nazis and making disrespectful remarks about the poppy. He has not yet done so. As I understand it, Rob has some fairly pressing family matters today, but this is, it is nothing new for me to hold the UCP to account. I have been doing it for 4 years. I have pointed out at every step of the way as we were losing doctors, as our medical services were being reduced here in Lethbridge, that Nathan Neudorf bears responsibility for this healthcare crisis that he helped author, and today I'm continuing to do that.
Thank you very much. No follow-up.
any more questions in the room?
Hi Shannon, Micah Quinn from Bridge City News. You mentioned, I guess, the NDP's plan in terms of healthcare if the NDP is elected. Maybe can you just reiterate how the NDP would attract and retain doctors? Because obviously that's been the biggest issue here in Lethbridge here too.
Absolutely. Well, there's a couple of ways. First, the family health team concept for a new clinic here in Lethbridge, and we've already committed that at least one new clinic will open here in Lethbridge. That is a different way of approaching remuneration for physicians, and we know that it will go some of the way to ensuring that we have new physicians practicing family medicine here in Lethbridge. They are placed inside a team of other health professionals, whether it's nurse practitioners, social workers, pharmacists, physiotherapists, you name it, to ensure that people's health needs are met in a much more holistic way. That's one piece. We will make sure that we have a new clinic here in Lethbridge. The other piece is, of course, the training component. And what we know is that when family physicians do their residency and some of their other training in smaller centers, they're more likely to stay in those smaller centers. So what we need is government to come with a bit of funding for the University of Calgary Medical School to work with both the University of Lethbridge and AHS South Zone to ensure that we have more residents training here in Lethbridge. And that is what we know will ensure that they'll want to take up their practice here. I think that we all know people who have moved here to Lethbridge from Calgary or Edmonton or other large cities. And once people come here, experience the quality of life, know what great assets we have in both our community and also the natural beauty that surrounds us and just the wonderful ways that we can raise a family and build a life here in Lethbridge. We know that people will want to stay, but we need to make sure we fund those training positions here. That's the first step, and we will make it happen.
Any follow-up? Okay, we'll go to the questions on Zoom. Again, if you'd like to get in the queue, use the raise hand function or the star 9 if you're over the phone. As well as please state your name and affiliation. Catherine, should we go to ID?
If you have further context for this video, like it looks like he was on an election forum, like what was the question he was answering there?
Sure, Catherine, we have a full 1 minute and 20-second clip that we can send over to you. The question was regarding healthcare, as pretty well every question that I've taken at an election forum here in Lethbridge and every question that I get on the door. It is the #1 issue facing voters here in Lethbridge. I cannot tell you how many conversations that I have in the run of a day, in the run of an evening, when I'm out canvassing, when I'm at forums that concern healthcare. So for the Deputy Premier, the author at least the co-author of this crisis, to then put out there that maybe people should have to pay is astonishing, because that is not what his constituents are asking for. It's not what anyone here in Southern Alberta are asking for. They're asking for basic health care, and they haven't got it from the UCP.
Do you have a follow-up, Catherine?
Yeah, and I think in his answer he had mentioned, I think he said his ER nurse wife works in triage and said she's seen abuse of the system. So I guess what would you say to the healthcare workers who are in the hospital who know these people should be seeing a family doctor and are coming to emergencies with problems that should otherwise be dealt with at a family doctor level?
I would say that under the NDP, we will open a new clinic, and we will make sure that primary health care is there for people when they need it. We've seen an almost complete reduction of walk-in capacity, walk-in clinic capacity here in Lethbridge. So if it's 10 o'clock at night and you have a 4-year-old that has begun to spike a fever and beginning to exhibit the symptoms of strep throat, you have to go to the emergency room. There is nowhere else to go. If you have a prescription that needs to be refilled relatively urgently, there is no walk-in clinic. There are no doctors taking new patients. I talk to people who have moved here from elsewhere pretty well every day or on an every second day basis. They do not have access to a physician because there aren't any taking new patients. So if they have a health concern and there is no walk-in clinic, they have to go to the emergency room. So what I would say to those frontline workers is that an Alberta NDP government led by Rachel Notley will invest in primary health care and ensure that we start to dig ourselves out of the hole that the UCP has created for us here.
Great, we'll go to our next caller. Again, please say your name and your affiliation.
Hey, Tim Brook with CTV. Thanks for taking my question. You poked at it a little bit there, but I just kind of want to go back to broad healthcare right now. It's not on a Lethbridge scale, but on an Alberta scale. What is your party going to be doing differently here to attract and retain the staffing that's so desperately needed in every Canadian province right now?
Absolutely. Well, I think obviously it's been a 4-year-long war on healthcare in terms of instability for frontline workers, putting massive wage rollbacks on the table to nurses and other allied health professionals in the midst of a pandemic, tearing up the doctors' agreement and so on. So the first step is, of course, stability. The second step is some of these focused and pragmatic ideas that Rachel Notley has been talking about for a couple of weeks now during this campaign. One, the family health team clinics, opening new clinics across the province with that model of a diversity of healthcare providers will ensure that we're meeting that primary healthcare need. Two, we need to make sure we are funding those residency positions in communities around the province and also in our two big medical schools, and that post-secondary students have the support they need to be able to make it through that undergrad and into either the graduate or after degree program of their choice. There is no question, too, that we need to fund more seats within those universities and in the colleges, as when we're talking about other allied health professionals like healthcare aides and LPNs. We need to make sure that healthcare remains our focus. And what you don't do is continue the war on public health care with statement after statement saying that restoring a payment relationship with physicians is the way to go. What you don't do is introduce instability into the governance of our healthcare system by musing openly about selling off public hospitals. Healthcare workers from across the country or even around the world are going to be very hesitant to pull up stakes and move to Alberta that otherwise has a number of advantages to moving here. If that's the kind of unstable career path that they're going to go into, if they're in healthcare, there is no way that is the way to attract and retain healthcare workers from across the country. People are paying attention. They hear the Premier when she speaks. They hear the Deputy Premier when he muses openly about charging us for an emergency room. And they will go elsewhere. So what we need to do is respect our healthcare system and the frontline workers in it.
Do you have a follow-up?
Yes, thank you. You mentioned the war on public health care there. That's something that your party has been talking about a lot during the campaign cycle, even before that. The UCP continually claims that they're improving wait times, that net gains, that there are net gains in staffing as far as healthcare workers are concerned, specifically nurses. They just say the NDP is fear-mongering here to try to get a vote. What's your response to that?
I would encourage the UCP to go knock on some doors. The fact of the matter is that voters continually talk about healthcare. That is the number one issue animating this community, and I know for many of my colleagues across the province. To put their fingers in their ears and claim that somehow the healthcare system is fixed is contradictory to all available reality and evidence. That is not how frontline healthcare workers see it. That is not how patients waiting for care see it. It is not how families supporting folks in the midst of a healthcare crisis see the healthcare system. I'll give you an example. I was just talking to a woman 2 days ago who, because of the shortage of OBGYNs, is putting off having a second baby. I talked to a woman on the same day who's waiting more than 24 months for a hysterectomy. I talked to a man on the next day who had just moved here from Nova Scotia. They are not even starting their physician relationship here in Lethbridge because there is no one. They're going to Calgary because they need specialized OBGYN care. So they are going to be spending thousands of dollars on top of their move across the country to come here, driving up and down the highway for healthcare, which, by the way, is exactly what Danielle Smith told people in Lethbridge to do. She said that pregnant women who require an OBGYN should go to Calgary.
Okay, we'll go to our next caller, Dean Bennett.
Hi, Shannon, hope you can hear me.
Yes, I can. Thanks, Dean.
Just want to follow up on Kat's question there. Can you just, I'm flying a little bit blind here. What is the context of this statement from Nathan Neudorf? Sounds like it was in a, when was it? What was the context? And are you providing, obviously we need to make sure you're providing the entire context of this question and answer and not just a snippet. So can you sort of fill in the blanks, please?
Sure. I mean, it was a question about healthcare and the crisis that's been created in healthcare. And Nathan Neudorf's response that it was that perhaps people should think twice about visiting an emergency room, and if they had to pay, then they might think twice. Almost all of our questions at these forums, or a good amount of them, have concerned the healthcare system. And this was one of his responses to those queries about healthcare and the state of healthcare here in Lethbridge.
Do you have a follow-up, Dean?
Yeah, I mean, I can get this information later, but I'm looking for dates and that sort of thing.
Oh, it was on Monday. Sorry, Dean, I'm sorry, I didn't provide you that context. It was on Monday evening at the Lethbridge Public Library.
Oh, I see, okay.
Yeah, so it wasn't 18 months ago, Dean. It was barely 48 hours ago.
Oh, well, that's kind of, okay, because I was going to say that none of this matters because the UCP leaders already said that we're not going to have any private care, we're not changing anything on Medicare, we're not going to make you pay for any other prescriptions, and so none of this matters. But I guess that's still my question. Does any of this matter, given what the Premier has said?
Well, I mean, when you have your Deputy Premier running around saying that people should pay for access to an emergency room, and perhaps that might teach them some sort of lesson, it is well within Danielle Smith's already often articulated views. And in fact, she's talked about that in terms of the quote-unquote restoring the payment relationship with family physicians. So this is not just a pattern. At some point, it veers into being a plan. This was Monday night that these views were expressed to a community that has lost dozens and dozens of doctors, and where families have to access the emergency room because there is no other option for many, many people with their primary health needs.
Perfect, so we'll do one more pass for questions. Any more questions in the room?
Eric Bay, Global News. Earlier this week, we asked Nathan Neudorf just his thoughts to the Lethbridge teaching clinics that the NDP announced on Monday, and he called it similar to what the UCP already has in motion, and mentioned a few examples, including the exploratory of teaching clinics outside the major cities, including one at the University of Lethbridge. Did you want to provide any response to that comment?
Yeah, I mean, the government, after after dozens of doctors left here in the South Zone, and after, by my count, about 2 years of news conferences, or 2.5 years of news conferences of me raising the alarm about this issue, the government undertook a feasibility study in January for a couple of institutions across the province. That was nice. Planning for a plan is nice for them, but doing things, putting things into action and into motion in a focused and pragmatic way, using good advice and good evidence, and with a plan that we can trust, led by Rachel Notley, is of course the plan that people here in Lethbridge can trust and that they understand will actually get done.
Perfect, we'll do one more pass for questions. One more pass over Zoom. Seeing none, that concludes today's press conference.